oral cares. So you will begin by checking the patient's chart, making sure it is time for them to have their next oral care. Then go into the room, introduce yourself, wash your hands, and apply your PPE. You will then make sure that you have all your supplies. You'll make sure your suction is turned on and hooked up. And then you will get your first package out and assemble your Yonker. And then remove your suction line from the inline suctioning and attach your Yonker. And then you will turn your suction on and suction through the mouth, making note of where the ET tube is so you don't move it anywhere during this process, and get pretty far back into the mouth. Then you will attach your swab and dip it into your debriding agent. Then you will swab inside of the mouth, and then periodically turning on the suction. Make sure you are getting in between the patient's teeth and lips on their front and sides, also on the top of their mouth and their tongue. And then you will get your swab, you will suction again one more time. So go ahead and suction through the mouth again. And then you can go ahead and plug back into your inline suctioning if you need to. And then swab the patient's mouth. Get the moisturizer on all sides of the swab. And then swab all inside and at the lips. And making sure you don't pull that ET tube, okay? Then you will throw that package away. 2 hours later, you will come back for the toothbrush part. So you will hook up your Yonker and suction, and then you will connect your toothbrush, and then use whatever debriding agent comes with your toothbrush. For us, it's this little brown cup that comes with the entire package. So you'll dip that into that debriding agent, and you will brush the patient's teeth, making sure you get down in between the lips and the teeth on all sides, bottom and top teeth, and then brush the patient's tongue and get the roof of the mouth right next to that ET tube, and then periodically turning on the suction during this procedure too. Okay, then you will suction again, getting as far back as you can without making the patient gag. And then hook back up to your inline suctioning. And then you will moisturize again. So again, get moisturizer on all sides of the swab and go all around the patient's mouth, and then specifically the lips. Again, making sure you don't touch the or pull the ET tube. Then you will, 2 hours later, come back and do the catheter. So you will get your Yonker and suction first. Suction all through. Okay, and then you will attach your catheter, trying your best to keep it clean. Okay, you turn it on, and then you will guide it to the back of the throat. And then, if you can, go down into the trach and suction around the top of the cup. Okay? And you'll want to then suction with your Yonker again. So suction all through here. And then if you have some extra swab kits, you can debraid and swab one more time, but most importantly, that gives you another swab with moisturizer, so you can get your moisturizer out and moisturize one more time, and then make sure your suction is plugged back into your inline suction. And then you want to make sure that the patient's comfortable, that there is no secretions, you're not hearing any secretions, and then make sure their head of the bed is at 30 degrees. remove your PPE, wash your hands, and then go chart on the patient's chart that you did oral cares. Thanks.